Okay, so on this slide is our agenda for the session. Again, the purpose of our event today is to help you answer the question, why nutritional sciences at the University of Michigan? And again, today's event is focused on our master's programs. So it's broken up into two sessions. The first session from 4 to just before 5 o'clock is going to be our information session about our master's program. We'll go over some of the degrees and the curriculum and steps to apply and a question and answer session. And then from 5 to 5:30, those of you who are interested in the dietetics or exploring dietetics, we have a dietetics information session for you. So you'll want to stay on this Zoom session. Susan Aronson, who you'll meet shortly, will be hosting that session. Okay. So we're going to begin with introductions. We'd like you to get to know us a bit better. And since I'm already speaking, I'm going to just step right in and say again, my name is Sue Cole. I'm a lecturer in the department and I teach several of the core nutrition classes. Kate?
Okay, unmuted. Hi everyone, I'm Kate Bauer. I'm an associate professor here in the department and also chair of the admissions committee. So thanks for joining us. It's this evening here in Ann Arbor, almost. I don't know what it is where you all are, but welcome. Patty, pass it to you.
Thanks. Hey, everyone. I'm Patty Ramos. I'm a lecturer in the department as well as on the admissions committee. I teach or I co-instruct a food service and food science class, and I'm happy to be here today.
Susan?
You're on mute, Susan. She knows. All right, maybe it's loud where Susan is. Keegan?
Hi, I'm Keegan Grimza, and I'm the Student Services Coordinator for the Nutritional Sciences Department. And I work closely with Carol, who you'll meet in just a minute. And we make up the Nutritional Sciences Student Services team. And we work closely with prospective students to help support you through your application process. So if you guys have any questions regarding the application or prerequisites, just feel free to reach out to us and we'll help you get those answered.
Carol?
Okay. Yes. Welcome, everybody. I'm Carol Durgee, part of the Student Services and Admissions team. So we're excited you're here today. And as Keegan said, we're here to help you through your process of your application. So any type of questions you have, you can reach out to us. Yeah, so we're excited to have you here tonight.
Susan, are you?
She's having some technical difficulties.
Difficulties? Okay. We'll circle back to Susan. So. Okay, Kate?
Yeah. All right. Well, I get the honor of introducing you to the Department of Nutritional Sciences, School of Public Health here at Michigan, and a bit about why you might want to come and live in Ann Arbor with all of us. So the Department of Nutritional Sciences is one of 6 departments within our School of Public Health. We like to call it a moderate size faculty. We have grown quite a bit from a small size faculty in recent years. So we do have 34 faculty members who teach 46 courses. I'll talk about this a bit more in detail later, but our faculty range from everything from basic science and animal models all the way out to food policy and systems. And so we are able to offer courses in all of those areas. We have a lot of research also going on here in the department. Most of the faculty have research programs. Again, some of them are in the lab with mice. Some of them are working with human subjects. Some of them are analyzing national data sets. There's all sorts of opportunities for research. And we are the home of 3 different research centers here in the department. We have 107 students. As you can see, most of them are at the master's level, so either in the MPH program or in our MS program, but we do have 17 PhD students who are here generally for 4 to 5 years working on building independent research. And we do have over 900 nutritional sciences alumni. And that, I don't know how many of you, some of you may be at the University of Michigan right now, or, know something about it, maybe through football, but our university alumni network and school and department alumni network is like nothing you've ever seen before, which offers many opportunities for jobs, internships, learning about volunteer opportunities, even just someone to go and talk to and, what can I do with this degree? I want to learn about your career. And so all of this put together means that we have a very vibrant and dynamic department, but we're still small enough and the right size that we get to know all of our students and we can still personalize your experiences in many ways. All right, next slide, please. Okay, so what are some of the reasons that you might think about joining nutritional sciences here at the University of Michigan? I would say one of the major things is that we are one of the few departments of nutrition or nutritional sciences in a school of public health. And so what that means is that you are collaborating with, taking classes with students who are learning health policy, students who are learning health equity, epidemiologists learning those kind of methods. And you're able to take and gain skills around a really wide focus on what health means and how nutrition and what we eat and where our food comes from and how we digest things, how that all fits into our larger understanding of what promotes health and well-being. I just think I've personally always been in schools of public health through my graduate training, and it's just a really comprehensive lens that understands the social, biological, genetic, cultural views on who people are and what health means and how we can support people achieving health. We also are really unique and special because we have the ability for you to pursue in your RDN or registered dietitian eligibility in the context of an MS or MPH program. And we'll go into some of those details later. But I don't know how many of you are considering becoming a registered dietitian, but we have an incredibly successful program where your experiential hours are integrated into your coursework. Excuse me. And our students have a near 100% success rate when they finish our coursework and experiences and they take the RD exam. We also have lots of flexibility, right? Many of our students are very, very interested and excited by nutrition, and so take the vast majority of their classes in our department. But, right, you can take other things across the School of Public Health. You can take other courses across the university at Ross Business School, at Ford Public Policy School. Michigan is a massive university with so many different options that joining us here allows you to access. Personalized academic advising. So all of our faculty have academic advisees. You're going to meet individually with us, the faculty in the department, the people who are doing research, the people who are teaching the classes. And again, we get to know all of our students and we understand where you've come from and where you want to go, and we help you get there. We are, again, this small department size, and that allows us both to know, for faculty and students to know each other, for students and students to know each other. I'll also say Carol and Keegan have done an amazing job increasingly in recent years, putting together a lot of social activities. There's Halloween party coming up and an ice cream social and tea ceremony. And so it's just a really exciting, warm, friendly place to be. We do offer a number of scholarships and fellowships to our master's students. I will say it is relatively rare that an individual would have all of their tuition covered, but we do try to offer very generous scholarships that maybe are a half of tuition covered or a quarter of tuition covered. But if financial concerns are a major barrier to you matriculating here, let's have a conversation about it, right? I think with all of these things, we're here to help you, and we will do our best to have this degree program fit into your circumstances. We also have many, many student organizations across the university and across the School of Public Health that you are welcome to join. Just last night, I actually went and spoke to a student group who's putting up little sort of free food pantries out around the community. And they've built these like super cute, like the free little libraries, they're doing food pantries. So it was really fun to meet them. And I was like, you're doing amazing work. More people should get involved, right? And so that's just one of many, many organizations that you can join when you're here. And again, I also mentioned we have a global reputation and massive alumni network that people are always looking to help people. If you go out anywhere, I mean, New York, California, other places internationally, and you're wearing Michigan gear, someone will yell "Go Blue" at you because there are alumni everywhere. All right, Sue, next slide, please. All right. So our students end up in a wide variety of careers. This just gives you sort of a breakdown. 38% end up in a hospital or healthcare provider setting. We have many alumni who end up in the federal government, at at nonprofit organizations. Some people choose to be self-employed and do consulting work or counseling work, with a business that they created. And our alumni have ended up at premier organizations, institutions. And again, this gives you a sense of like, oh, maybe I want to see if the US federal government and go work for the USDA or the CDC or the FDA. There will be alumni of our school, our program, our university there. And it really opens up a lot of doors. Our students have been very successful career-wise. Next slide.
Recording in progress.
Oh, Susan's back. All right. And so I'm just going to give a brief overview of our research. As I mentioned, we have research happening all the way from cells and mice and things that I don't understand because I work with people, all the way out to interpersonal relationships and how do we change people's dietary patterns when they are diagnosed with a disease? What should our nation's food policy be? What is global food policy like? And how do we influence, how can we influence diets of individuals in other cultures and countries? So we have a wide range of research. These images are just highlighting a few of our strengths. So we do have several faculty that work on developmental origins of disease. So how does mother's nutrition during pregnancy or even before pregnancy influence child health outcomes? There's a number of large studies happening here in the department that can track generations of families over time and exposure to nutrients, exposure to chemicals, right? Chemicals in our food. We have all that kind of research happening. We also have research happening again around minerals, right? So magnesium and zinc, and how does intake and our body's processing of those minerals impact our health outcomes? My own research is represented here in the bottom left corner. I research families and how do we engage with children around eating, both what we eat and how we eat and our relationships with food. And then how can we implement social systems and policies that makes nutrition easier for families, right? So families don't have to stress and worry. Are they going to have enough money? Can they buy food for their family tonight? So that's really the focus. Those interpersonal relationships and social influences are the focus of my research. And then the bottom right corner is representing, in particular, Dr. Andy Jones is very interested in global nutrition, the evolution of different food systems in Asia and Africa and South America, and how transitions in food systems and global warming and sustainability are impacting people's nutrition and people's livelihood. So really, many nutrition, the scope of nutrition research is happening here in the department. Next slide, please. All right, so this I actually put together a couple of years ago, and I went and asked our students and our faculty about what makes Michigan unique. And I won't read through all of this, but I think the overwhelming theme is our energy, our collaboration, the community that we have built here. So you can do amazing science and learn amazing skills and become a fantastic clinician or practitioner through our courses, and have a really enjoyable and fulfilling experience and build lifelong relationships through the people you meet here at Michigan. Next slide. All right. And then thinking, your whole life when you move here is not going to be in school. We don't want it to be. We want you to enjoy living in Ann Arbor. All that comes with this college town. I mean, this is the epitome of a college town. I know the football is not doing so well this year, but we will get back to it. And the games are fun to go to regardless. We have art museums. We have musicians who come. We have several movie theaters. We have shopping opportunity. We have restaurant opportunities. You can walk. You can bike. It's really, especially now with the leaves changing, it's a beautiful, beautiful place. Plus, we're 40 minutes outside of Detroit. I've actually been in Detroit like 4 times in the past week. So if you crave a bigger city, if you crave, big national sports teams, that's here. If you crave nature and hiking and cabins and Great Lakes to go swimming in, that's within a couple of hours too. I will tell you, my colleagues have heard me. I'm from New York. I never thought that I would, find a home here in the Midwestern US. But it's a really, really enjoyable place with just really lovely people and opportunities. It's a very nice place to be. All right. And that's the conclusion of my section. So I'll pass it back to you, Sue.
Thank you, Kate. So the next segment, I'm going to be providing an overview of our degree programs. So we offer 2 master's degree programs, Master of Public Health and Master of Science. And one of the strengths of our department is that students who wish to pursue a dietetics concentration can do both, or can do it in both programs. So both Masters of Public Health and Master of Science students that want to pursue dietetics can do so in both programs. I also want to point out in the Master of Science that you could choose to do an MS in which you complete a thesis, or you can complete a Master of Science pursuing clinical nutrition. And I'm going to talk a little bit more about those degree programs in the next slide. I also want to note that we do have a doctoral program. Our event today is focused on the master's programs. However, if you have questions about our doctoral program, please let us know in the chat and we can connect you to someone who can provide you more information about our doctoral program. Okay, so you may be wondering, which master's program is for me. So we hope this table will help you with your decision. So you'll note that we have 3 columns of our master's programs, and I'm going to go through each one of them, beginning with the MPH, or Masters of Public Health. So this is a practice-oriented professional degree, which provides our students a strong foundation in the principles of public health, as well as nutritional sciences. And students pursuing a MPH again, can pursue also a concentration in dietetics. So you will have, so you can become an RD with an MPH. You'll complete dietetics coursework in addition to your supervised experiential learning hours, which Susan will share a bit more in a couple slides. So that's in terms of those who want to pursue dietetics. In terms of activities that our MPH students participate in, it ranges from courses, for example, our public health core curriculum, which you would take your first year, both in the fall and the winter. Students in that course or that whole curriculum emphasizes a collaborative, interdisciplinary approach. That fosters a sort of holistic understanding of public health challenges and concerns. And that also encourages innovative problem solving of public health concerns. There's other experiences, including a summer internship, where students can gain community experience. All MPH students will complete a summer internship between their first and second year, and I'll go over that a little bit more in a later slide. I also wanted to just point out that we have another course where students gain experience collaborating with other health professionals, so interprofessional health education. So again, it's the experience of, or the different activities that Masters of Public Health is diverse. And the types of courses that students take, they take core Masters of Public Health classes, as well as core nutritional science classes, as well as community nutrition. And again, those pursuing dietetics will also take their dietetic coursework. And then all students will have some electives. And again, I'll go over this more when I cover curriculum. In terms of the Masters of Science, students pursuing an MS degree, this is a research-oriented degree providing skills in both either basic science or population or nutrition epidemiology. And so we have two tracks: population and nutritional sciences, and molecular and biochemical nutrition. So students pursuing the population and nutritional sciences track will gain experience developing a research project using national survey data. These students will gain population-based research skills, analytic skills, applying statistical methods, but these students also gain population-based skills implementing and learning about survey methodology. Whoops, I'm sorry. It's changing. The other track is molecular and biochemical nutrition, molecular and biochemical. Students pursuing this track will select a project from a list of project options. So in their first semester, they'll select a project. And students working through these projects will gain research experience that may involve laboratory work. They may involve data collection, or an analysis of data that has already been collected, or a mix of all three activities. Again, in this degree, MS degree, students who are interested in pursuing dietetics may do so. They'll have additional dietetics coursework as well as their experiential learning. Activities that the MS students participate in is leading development of their research thesis with their faculty mentor and their committee. In terms of types of courses, our MS students will be taking epidemiology and biostatistics, as well as nutritional science core classes. Again, if they're in the dietetic concentration, they'll take dietetic courses, and they also will have some opportunity to take electives. And then finally, our students pursuing the Masters of Science Clinical Nutrition, these students will gain clinical nutrition skills, research skills, developing a deliverable that informs clinical practice. So students, again, in their first semester, will select a project from a list of projects, and then they'll collaborate with a clinical mentor on their project. So examples of deliverables might be a manuscript. It could be a lit review, developing a manuscript that can be published. It might be developing a professional presentation that would be given at a conference or a meeting. It could be a combination of a manuscript or a presentation at a professional meeting where they may also develop education materials that are used at the clinic. So all students in the MS Clinical Nutrition are also pursuing dietetics. And activities that they will participate in will be collaborating with their clinical mentors on the clinical nutrition research. As with the other MS option, they will be taking epidemiology and biostatistics, nutritional science core classes, as well as some electives. The other thing I just wanted to point out that with the Masters of Science, those students may elect to choose that degree if they're interested in working as a research coordinator or research manager, or if they intend to pursue a doctoral program sometime in their career. Working through developing research questions and a thesis and strengthening those research skills before they apply to a doctoral program. So. Okay, Susan?
Yeah, finally. Sorry for my little bit of technical difficulties. I'm sitting on pins and needles waiting for my screen to shut down again, but I can introduce myself. I'm Susan Aronson. I am a lecturer in the department and I direct the dietetics education program. So if you are here at the University of Michigan to pursue the path to become a registered dietitian, I will be one of your primary contacts. I'm going to keep this slide super short because if you are interested in dietetics and you really want to learn a little bit more and a little bit more in depth, stay on from 5 till 5:30. And I have about 10 slides where I'll go through some more details and give some examples of like what the supervised experiential learning component is of this particular degree. So for those of you that are maybe a little bit undecided, just to give you a brief overview, Dr. Cole already mentioned the different degree paths that you can pursue if you want to become an RD. And the interesting thing about our program is it now integrates the didactic coursework, so the coursework in your classrooms with supervised experiential learning, otherwise known as like internship. So we used to be a separate standalone didactic program and a separate standalone dietetic internship. And we've recently integrated this into a graduate program that actually combines the supervised experiential learning all throughout the 2 years that you'll be here pursuing your degree. So the model has worked, really, really well for us in that, for example, you may in your very first semester take a nutrition counseling course. And while you're taking that course, you'll learn motivational interviewing. And when you're learning the motivational interviewing, you'll be able to practice the motivational interviewing skills with other peers in your program in a really safe environment. And then as you gain those skill sets, you'll be able to practice in our counseling center with other peers here at the university, and then eventually go out in the summers to actually practice in clinic. So we have this really nice scaffolded approach. So in addition to that and all the coursework where you'll hear a little bit more details, you can also come and like explore a certain career pathway, because there's not just one niche. If you want to become a registered dietitian, we have clinical dietitians. We have dietitians that work in sports nutrition. We have those that work in policy, those that work out in the community, those who work in food as food service managers, those that work in like development of food products. So if you've got like a specific area where you want to work, we allow you to take a couple of weeks and to work in that area so you can really gain more depth in-depth experience to determine whether or not that's a pathway that you want to take when you're ready to take your first job as an RD. So basically, it's this three-step process where you're taking coursework. You have 1,000 hours of supervised experiential learning. And when that's all said and done, I will provide you with the verification statement, and then you are eligible to sit for the RD exam. So from start to finish, it's about exactly 2 years here. The one difference between dietetics and non-dietetics degrees is that you will spend 2 full summers with us. So the second summer, after you finish the second year of your coursework, you'll be completing another 300 hours of supervised experiential learning, and you'll actually graduate in August. So that's a different, it's a different end date compared to the MPH without dietetics and the MS degree in nutritional sciences without dietetics. But more to come at 5 o'clock, and I'd be happy to answer questions then too. Okay, next slide.
Thank you, Susan.
Sure.
Okay, so in the next few slides, I'm just going to provide an overview of our curriculum for our master's programs. So for our MS Masters of Science programs, we have breadth courses, that is our biostatistics and epidemiology. And then all of our MS students will be taking core classes in nutritional sciences, including our macro and micronutrients, nutrition assessment, as well as several courses, research topics, innovations in nutrition research. Students will also have the opportunity to take electives, so they can take electives in our department, they can take electives in departments, other departments in the School of Public Health, or across campus. So as long as they're graduate courses, there's opportunity to take at the business school. We've had students take courses in the School of Social Work and so forth. So it's a wonderful opportunity to explore other interests. Our MS students that are completing a thesis, again, we'll work with a mentor. They will also have a committee of 3 faculty to help them develop and execute their research plan. For the students pursuing an MS in clinical nutrition, again, they'll have a clinical mentor or mentors to help them execute their project. Okay, in terms of our Masters of Public Health, the curriculum includes a breadth of public health courses that range from biostatistics to communication fundamentals, qualitative methods, and this is in accordance to the Council on Education for Public Health, or CEF. As I mentioned earlier, the core, these core topics are completed in students' first year. It's a 6-credit course in the fall and winter. And again, these are your core public health topic areas. MPH students also take core nutritional sciences, again, macro and micronutrients, nutritional assessment, and they also have to complete a course in where they gain skills in program evaluation. We also have a research seminar that all our students attend, and that gives them a breadth of nutritional science research. We have researchers coming in from our campus or from other institutions nearby, again, presenting their research, which is related to nutritional sciences. All students complete a capstone in their second year, working on professional communication. And then again, students have in the MPH degree have the opportunity to take electives. And then all Masters of Public Health students complete a summer internship between year 1 and 2. Those in the dietetics concentration will complete their summer internship. And this is a public health oriented summer internship. Forgot to mention that. That will be completed in their experiential learning in the summer. So again, that's dietetic students will complete their summer public health summer internship as part of their experiential learning in the summer. Our students also have an opportunity to explore some other topic areas, so focus areas. So students that have an interest in sustainable food systems or maternal and child nutrition, on our website, we have a list of courses that are in the, that in the area of sustainable food systems or maternal and child nutrition. So again, students that have this interest can look at, kind of go through a menu of courses and to expand on and further their knowledge and skills in these specific areas. It's a very informal process. Again, it's just a listing or a resource for students of courses in these two areas. There's a more formal approach of gaining a focus area, and these are graduate certificates. And you can see we have a maternal and child nutrition, physical activity, diversity and equity, inclusion, and health informatics. So this is, again, another opportunity for students in a more formal framework to pursue a particular interest. Okay.
All
Patty?
right. Thanks. I'm going to talk about applying next. So hopefully by now you're wondering, how can I apply to this awesome department? And I'm going to tell you how in the next few slides. Next slide, please. Thanks. So how you apply is going to depend on which program that you're applying to. So those of you who are interested in applying to the MS or the PhD program, that's going to be through Rackham Graduate School. And if you just go on their website, it's pretty easy to find a link there of where you apply. There's a number of due dates that you should keep in mind. So those who are applying to the PhD program, as well as domestic MS applicants, your deadline, or at least the early deadline for the MS degree, is December 1st. And then domestic students, your final deadline for the MS program is May 15th. If we have any international students on the call today, your deadline for applying to the MS program is January 15th, 2025. And then those of you who are interested in the MPH, you'll actually be applying through a program called SOFAs, or the Schools of Public Health Application Service. Again, another website where you have to register, and then you'll be able to submit your application through there. Domestic MPH applications, early deadline is December 1st, just like the MS one, with a final deadline of May 15th. And then again, those international applicants have their applications due January 15th. Next slide, please. So what does a generally successful application look like when you're applying into our department here? We do look at the whole applicant, but these are some things that are part of that application, obviously. So we do like to see a strong academic record. We look at your overall GPA as well as a science GPA. So that science GPA is going to involve a lot of those core STEM courses that you've taken in undergrad. So biology, chemistry, biochemistry, courses like that. A strong GPA is typically a 3.7 or above. Now, if your GPA is lower than that, do not fret. Again, we look at the entire application, including your statements, letters of recommendation, your work, your volunteer experience. So again, don't worry if you're falling a little bit short of that 3.7 GPA. You will have to include 2 statements in your application, and we just want to see that you can construct, clear, concise paragraphs, thoughts to be conveyed to us about why nutritional sciences and why you want to attend school at the University of Michigan. A thing that we like to look for when we're looking at applications is, why are you choosing this path? So we always like to know your story of finding this passion. A lot of us who have found ourselves in this field have a certain event or a situation that happened when we were growing up that led us to an interest in nutrition. So tell us your story, tell us your why, right? And then secondly, too, why U of M? So there's a ton of universities out there who offer nutrition sciences programs. So is it because it's, the powerhouse academic center at U of M? Is it because you want to be in the state of Michigan? Is it because, perhaps, like Kate mentioned, we're lying within a school of public health? Which is a very unique aspect of this nutritional sciences degree. So make sure you articulate that in your statement, and it's a great way for us to remember you as an applicant. We require 3 letters of recommendation. So it's recommended to get these from a variety of folks who know you well and can speak very highly of your work. So think of professors or work managers or volunteer managers that you had a long-term volunteer experience. Those are all great people to get strong letters of rec from. And then we like to mention too, life happens, right? We have many different roles beyond being students. We are family members. We might have kids. We might have jobs. So sometimes life doesn't always go as planned. Maybe you had a semester where your GPA dropped because there was just a lot going on. Maybe you had to take some time off. And so if that does pertain to you, again, totally okay. But make sure you explain that in your statement so that we can get a better picture of who you are as an individual. Lastly, too, so if there are any prereqs that you haven't yet taken, again, totally fine, but we want it outlined in your statement of your plan for meeting those. So if you're currently enrolled in a prereq or you're planning to take some of those during the summer or the spring semester, make sure that that's outlined in your statement. And then I'm going to pass it over to Carol. She's going to talk about the Kira interview.
Okay. All right. Thanks, Patty. So I will briefly talk about the Kira interview. This is something new this year that we're piloting for our admissions process. It will be 5 questions that you will be asked, and then you will be recording your answers. And these questions range competencies on motivation, empathy, professionalism. You will be able to do a practice run first, and then you will have 30 seconds to prepare your answer, and then 90 seconds to actually record your answer. And so this is just a way for us to get to know our applicants better. If you have any more questions about this, let me know. It seems to, we know that some students have already started using it, but if you have any questions, you can reach out to me or to Keegan. And we're excited to get to know you over the application process. So thank you.
Next slide, please. Great. So these are the list of prerequisite courses that you should have before you're applying to our program. We do ask that you have a C average or better, and we have a list of them, all these courses right here. So take note too that these Gen Chem, inorganic chemistry, and organic chemistry, you do not need a lab with those. We know a lot of universities do require that, but to apply to the department, you do not need the lab. You also need biochemistry and then a human physiology or an anatomy and physiology course. Something that comes up with applicants each year is that we want this to be human-based. So unfortunately, no like frog physiology or animal physiology. It needs to be human physiology. For those who applying to the MS or the PhD degree, we want to see some sort of calc or statistics course. And then lastly, if you're interested in that dietetics course, we'd like you to see a microbiome class and then any English, psychology, anthropology, or sociology class. And again, if you are in the process of taking any of these prereqs or still taking some in the summer, make sure you note that in your statement as well. We're at our Q&A.
Okay, thank you, Patty. So we're at that point of our presentation where we'd like to invite you to ask questions. Please feel free to unmute your mic if you'd like to ask a question or use the chat.
Hi, I have a question. I'm wondering how big like each cohort or class size usually is per year.
That's a great question. I would say that's are they close to about 50? Carol, is that?
I'm sorry. I'm in the chat.
That's right. I
Oh,
can
sorry.
answer. Yep, you
Yeah,
are
Kate, yeah.
exactly right, Sue, that last year we had 50 new students join us, but also remember that's across our MPH degree, our MS Nutritional Sciences, and our MS Nutritional Sciences. Wait, sorry, I repeated. MS Nutritional Sciences, MS Clinical Nutrition, and then PhD. But so yes, every year there's between, I'd say 50 and 60 new students joining. So where does that leave class sizes? Personally, I've never taught a class larger than 25. Sue, you teach some of our larger classes. Like
So
how
I have 45 in my
okay.
nutrition assessment course this semester. Yeah. So it's MPH, MS, and PhD.
So
Yep.
it's a nice size cohort, I think. I don't know, Caroline.
Yeah, that
Does
that
that
sounds
scratch your itch for an answer?
yes, that's perfect. And then to sort of go off of that, what's the acceptance rate usually?
Yeah. So our acceptance rate is relatively high. I'd say it's above 50%, but below 100%. It really varies by which of the, so like PhD is very low. That's a whole other topic, but our MS is probably just above 50%, maybe a bit higher. Because we find that so many students have done the things we've asked them to do. You've taken the prereqs, you've talked about yourself, you have volunteer experiences, you've shown why nutrition. So yeah, I would not say, how do I say this politely? We always take a holistic view of your application. And if your GPA is in the right range, above 3.0, and you've shown yourself professional and have strong letters and have strong experiences, I would say you do not have to worry.
Okay, thank you so much.
Oh, I have a question. This is Queen.
Yeah.
Hi. So regarding finances, because I know it's not cheap to be in a PhD or MS program. Do you have any financing for PhD and MS programs?
Yes. Yes. Kate, do you want to?
Sure. So PhD is sort of a whole different story. Um, I would fundamentally, we do not accept someone to a PhD program unless we can fund what we anticipate to be your entire time here in the program. And when we say fund, we mean tuition, fees, and a stipend. And you may earn that stipend through being a teaching assistant, a research assistant. We have some fellowships, things like that. So think about PhD, and hopefully, I'm just going to put that out there. No US university should be taking you and making you pay to do a PhD. The model should really be that you have your work supported. The MS or the MPH or generally the master's programs are different. As I mentioned before, it's rare that we would cover a full 100% scholarship, but we do offer fairly frequently 25% to 50% scholarships. We recognize that out of state and international tuition can be very high here in Michigan. So many of our students, let's say you get a 25% scholarship, and that takes off some of the fees. There are job opportunities. Some students may take out loans, or have support, maybe save up for a couple of years. I mean, I recognize this is all a very privileged perspective, and different, we have students coming from all over the world who are in different financial situations, but unfortunately that is the reality that, I'll just say this right out, and if you're someone where you're like, there is no way I can do a master's degree unless I am getting full scholarship and a stipend, I would say it is very unlikely, if not impossible, that you would get that for our program. And I say that because we would like to have complete transparency and honesty, because the financials, can be very stressful. And so, if you're in that boat, we can have a conversation, but I just want to be realistic with you. I'm giving away all of our secrets, but I think it's really important that those things are not secrets.
Okay, thank you.
Hello, I also have a question. So I am doing a master's in one university and I want to change the university and I'm thinking apply for a PhD. And in my university right now, I know that when you are applying to a PhD, you have to find a faculty member before you get in his lab or something like this. And in another universities, you just do a general application and after that you get accepted, you search for a lab. So my question is, I need to find a faculty member before apply.
That's a really good question. So as Carol noted in the chat, we will have time on November 11th. Is that
Mhm.
the correct date? Yep. To talk specifically about PhDs. The way we work, we sort of use a hybrid approach to what you are saying. So you may, please study our faculty, read up on what our research are, because we want to make sure that there is a match for you, right?
Mhm.
Like, are you interested in social perspectives on nutrition? Are you interested in eating disorders? Are you interested in metabolomics or lipids or something like that, right? We want to make sure there's a match. We encourage you to reach out ahead of time and see if the faculty member has some time to talk to you and see if they are considering taking a PhD student. I will say, I'm going to, again, in total honesty, we get many, many of those emails a day. And it just gets kind of overwhelming to know what to say to everyone. So do not take it personally, please, please, if you don't get a response. I
Okay.
like to put that out there. Okay, so maybe, you've reached out, you believe that there's, the types of things you're interested in are happening in the school, but let's say that, unfortunately, you don't get a response. If you believe that Michigan is the place for you and that there is a match with an advisor, we encourage you to still apply because oftentimes after applications come in, we on the back end are able to match with an advisor. We're able to find a scholarship opportunity. You may be, depending on your background, you may be eligible for something, right? So again, it's a hybrid approach. If you find someone and you have a great conversation and you're a match and they are very interested in you, awesome, but that's not required and you can still apply and we will do the legwork to try to find a match.
Okay, thank you. And you mentioned that it's gonna have a day specific for PhD.
Yep, November 11th.
Okay, that's great.
Yeah, and
Thank
I added it to the chat,
Okay.
where you can register for it.
Yes, I will do it. Thank you.
Hello.
Hi,
Hello.
yes, we
Hello?
can hear you.
Yeah.
Yep.
Abiba here. So last year, I think I did apply and then I was admitted, but unfortunately, due to financial issues, I wasn't able to attend. I would like to know if the Cura assessment interview, will I have to go over my application processes again, or I do not have to do anything again concerning the application processes?
That is a very good question. Carol?
Yeah, I think, Abiba, can you email me? Because I don't remember if you deferred from last year. I can't remember.
She
So
deferred.
some of that, and then we'll have to, pardon, Keegan?
Sorry, she did defer last year.
Okay, so then Abiba, we'll have to talk to the admissions committee about this new requirement. So just email me and we can talk further about it. But thanks for being here tonight.
I just wanted to clarify about the Kira. I'm not sure if we said it, but if we didn't, the Kira interview is actually only for students that are applying to the dietetics program. So if you are not applying to dietetics, you won't be required to do the Kira.
Okay. Okay. Thank you. And Carol, please, I would be sending you the email.
Sounds good. Thank you.
Please do
Awesome.
not hesitate, all of you, if a question comes up to reach out. That's what Carol and Keegan and many of others us are here for. And it helps us get to know you and try to find creative solutions to things.
Okay.
I,
Well,
oh,
thank you,
I,
everyone.
Oh,
So
can we get one more question,
do we
Sue,
have?
from Caroline?
Oh, Caroline's okay.
sorry, I had one more question. I started my application for the Masters of Science to the Rackham School. But after this information session, I'm sort of interested in pursuing the MPH path. Instead, would I redo my application or does it like transfer over or how would that work?
You have to apply through SOFIS.
Okay.
Yeah.
Okay.
Sorry.
Sounds good.
They're
No,
two
that's what I
separate.
thought. I just
Yeah.
wanted to make sure.
Yeah.
Okay. Thank you.
Okay, so up next is our dietetic information session from 5 to 5:30. So Susan Aronson will be hosting that session. I encourage you to attend the session if you're interested in dietetics. It's a great opportunity to learn more about our dietetics program. If you're not planning to pursue dietetics, then this concludes our prospective student event. At this point of the segment, Dr. Bauer, Patty, and I will also be leaving the Zoom session. So we want to thank all of you for attending this prospective student event. It was wonderful seeing all of you. And lastly, be sure to contact us if you have any questions about our master's program. And again, just a reminder that a recording of today's session will be made available to all of you. Susan, I'm going to stop share. Here we go.
Yeah, I think I should be sharing now. So
You
hopefully
are, I can see. Yep.
Oh, perfect. Perfect. See you, Sue.
So bye, everyone.
Okay, goodbye to Sue and hello to everybody who's still on the call. Looks like we still have a bulk number of people, which is great. So again, I'm Susan Aronson and I direct the dietetics program, and I would be your director whether or not you're in the MS or the MPH program. I did add to the chat just one more thing about applications because I've received a couple of these questions is if you're somebody who's very familiar with the path to become a registered dietitian, you know in the past that to be placed in a dietetic internship, there's a separate portal through the Academy of Nutrition and Dietetics that's called DICUS. That's the acronym for it. And there are some graduate programs like our own that are using the DICUS portal, but we are not this year. So if you go to DICUS, you will see that our program is listed and there should be a note there that says we are only accepting applications for this cycle through SOFIS and Rackham. So I just wanted to point that out to everybody on this call who is here specifically because you think you want to apply to dietetics. So again, feel free throughout this next 20 minutes or so just to put questions in the chat. Carol and Keegan can answer them. And if it's something really specific, dietetics, they can bring it to my attention because I'm just going to be focusing on my slides, but there's also going to be an opportunity for questions at the end. So with that, I'm just going to move on. So this is just, even though it's just me here in terms of our program, I just wanted to show you that we have a really in addition to Carol and Keegan, we have a fantastic team that works to help guide all of our students through this program. Sarah is my counterpart, and she was actually in the in-person session on Saturday, so she's not here today, but she directs all of the dietetics training, which means she is responsible for making sure that you get those 1,000 supervised experiential learning hours and that we have the sites for you to go there. She also teaches some courses in our program. Amanda helps manage all of our data and is like a guru at communicating. So many of our communications come from her. And Erin is actually a graduate of our program, I believe from 2018. And we hired her about 4 or 5 months ago to be our clinical coordinator. She has a few years of experience in, acute care and clinical care in a variety of different settings. And she's going to help place you in those acute care clinical settings and then many of the outpatient settings where you'll get a variety of different experiences from perhaps cardiac rehab to diabetes care. So this is our team. And once you're a student here within our department, you'll get to know all of us really well. We do have monthly dietetics meetings that are mandatory, and each one of us lead the meeting in a variety of different ways, depending upon the skill set we're trying to get you to achieve. So So obviously we don't have time to get to know everybody and for everybody to talk, but if you want to just add so that you can get to know each other as I'm talking, you already have your name, but maybe the hometown where you're from, and why do you want to become a registered dietitian? Because you are here to learn more about that. And there's a lot of different career pathways that you can pursue with the RDN, and it's kind of fun to see how everybody comes to this. So go ahead and take some time and add that to the chat, and I'll take a look at that once we get through the slides. Okay. So as I alluded to earlier in the presentation, that there are 3 components to dietetics education and 3 components specifically to our program here. There's lots of different ways to become a registered dietitian through the Academy of Nutrition and Dietetics, but we have what's called a graduate program, and I'll define that a little bit more in the future. So as you've already heard in the last session, you have to decide which degree pathway is right for you and make sure that you're in the concentration that allows you to be in dietetics and pursue the dietetics pathway. As part of our graduate program, you have to attain competency at various different levels. There are levels that you obtain competency in coursework, like at the nose level, where you're basically provided information and you can be assessed on various different exams so that you have a basic understanding. There's a competency that's attained at the shows level, where you can take that information and you can apply it to perhaps a case study. And then there's competencies that are achieved at the does level. And most of that happens when you're out doing your supervised experiential learning at all the various different sites where you'll be assigned. And I'll give you a little bit more detailed information on that. So you have your coursework, you have your supervised experiential learning. As I mentioned, you combine your degrees with your verification statement, and then you're ready to sit for the RDN exam. The exam most of you would be taking, let's say you're going to be starting in 2025, you will be taking your exam in September or October of 2027. The beauty of our new program is that you actually can enter the workforce about 6 months earlier than what you could in the past, because we're integrating the internship or supervised experiential learning hours right into our coursework. So you don't have a separate application. You don't have to apply to a dietetic internship. You don't have to pause in case that internship doesn't start until September. It's just a continual educational process until you're ready to sit for the exam. This is something called, you might have seen this before in some of your previous education, it's called the Miller's Pyramid. And this is what I alluded to in the past slide of making sure that you are you attain competencies at these various different levels. And what's really beautiful about this new program is that you have many opportunities to achieve these competencies through a variety of different experiences. And let's say at any step along the way, you're not achieving the competency at the level that needs to, then we have remediation plans. We can give you additional experiences. If we see that you're weak in a particular area, we'll contact one of our RD preceptors for you to spend a little bit more time with them to strengthen your skills, because our goal is making sure that when you graduate from our program, that you will be a competent entry-level dietitian, and we'll help you on that journey, because we commit to, once you show up on our doorstep to become an RD, we really want you to be successful in achieving that in the 2 years that you're here. So just like we had a curriculum section in the past session, I just wanted to list for you, in addition to the 4 courses there that are nutritional science requirements that Dr. Cole mentioned and described in a little bit of detail, we also have dietetics requirements. So I have those courses listed here. You get a sense of where you're going to be concentrating a lot of your coursework time. And then in red, next to the courses that have supervised experiential learning along with them, I just wanted you to note that that's how we integrate it into the 4 semesters. You'll be taking courses for 4 semesters and then doing concentrated supervised experiential learning in the 2 summers. And I have a slide that breaks that down. I'm going to give you an example. If you look to Nutrition 635, that's a course that I co-teach with Patty Ramos, who was in our call. And it's a food service and culinary science course. And in that course, there's also 80 hours of supervised experiential learning that you'll complete. That's happening this semester. So what students are doing is they don't have any classes on Wednesday. So on Wednesday morning, they go to their food service site and they work in that site for 8 hours every Wednesday throughout the entire semester until they achieve roughly 80 hours in that. And what's really awesome about it is that they are learning right now food service techniques and some various different culinary science principles, and then they're able to apply those in those food service sites on the spot. So it's a really nice integrated application-based learning system. Okay, so those are our courses. And this is kind of what it looks like in terms of, I've mentioned a couple of times that in addition to the coursework, you have to have a 1,000 plus hours, minimum of 1,000. Some students will graduate with more than that, just depending upon, you know, perhaps extra rotations that they received. And this is a nice graph that shows you in terms of percentages, how the hours are broken up. So as you can see, the majority of your hours will be obtained in summer one, which is our community clinical rotations. And in that, you might be in a WIC clinic, a women's, infant, and children's clinic. And, you know, there you're going to be working alongside an RD with young moms and their children up to the age of 5. You will also be in a skilled nursing facility. So that can be a rehab facility, a long-term care facility, a nursing home, and you'll be spending time in the skilled nursing facility along with an RD. And then a variety of outpatient clinics, just really depending upon your interest area. We'll ask you to complete a survey. We'll ask you where perhaps you might want to rotate in other parts of the state outside of Southeastern Michigan. We have a lot of out-of-state students. We had a student this past year who wanted to do some rotations in Texas and another in Chicago. So we help work with her to set some of those rotations up in other cities. It's really actually nice for us because it relieves our program of finding preceptors in the Southeastern Michigan area, which tends to be pretty saturated. Another bulk of your hours are going to be in summer two. So these are going to be the last things you do before you take your RD exam. This is where you're going to be inpatient acute care settings. We have 15 to 20 placements here at Michigan Medicine Hospital, and then a variety of different placements in Southeastern Michigan across the state. So you may be at any of these different rotations and sites, depending upon, you know, the surveys that we ask and where you might have opportunities to actually have family where you could stay with them in these different rotations. And then these the hours that are integrated into coursework are listed here in the last 2 lines there. So both your nutrition counseling, like I mentioned in my presentation, and medical nutrition therapy have supervised experiential learning hours in them. I'm going to talk in a little bit about our nutrition counseling center, and that's where you'll get many of your hours in your medical nutrition therapy course. And then you'll also, as I mentioned, the food service and culinary science rotations that you'll do at various different food service sites. And we have students this semester. We have them on campus dining halls. We have them in school systems, both here in Ann Arbor and in surrounding communities. We have them at daycare centers because daycare centers feed kids in mass, so in large quantities. And we also have some students that are actually at catering companies, you know, a completely different way of showing food service. And they all have unique and interesting experiences. Similar, Dr. Cole teaches the community nutrition course. So in your final semester, again, 1 day per week, you'll go out and you'll rotate through a community center as you're taking that course. And then we have a new course that we're offering in leadership and management. And you're going to have some opportunities to complete a management project during that time and earn some supervised experiential learning hours. So this is kind of the bulk. I mentioned the elective series that you can pursue. Again, that might be somebody who's interested in learning more about disordered eating, and you do some rotations at an eating disorder clinic, or it might be somebody who's interested in sports nutrition, and you're going to work with our performance nutrition team here at the University of Michigan in their Olympic sports and in their football-oriented sports. So lots of great opportunities, and we have literally dozens and dozens and dozens of preceptors in the community that we've worked with in the past where we can place you. I'll pause there.
Susan,
Yeah.
I had a question, and I've been busy in the chat, but can you talk about, do students have to secure a preceptor for their SEL hours?
Right. Sorry, I just had a piece of gum in my mouth.
Oh.
No. So we will secure your preceptors for you, with the exception of if you perhaps wanted to be in another state closer to home and we don't have a contact there or an alumni there, we would ask that you start to kind of search out. Let's say you want to be in Houston, Texas, and in Houston, Texas, you want to get your acute care rotation and you happen to know a dietitian who works there, so you might start that process. We would at some point chime in to help create an affiliation agreement, which is something we need to have with any precepting site. But in general, like all of these hours that I'm telling you about here, we help find those. So Sarah Ball goes out and she finds, for this first year cohort, we have 43 students in it. She has 43 different food service rotations, and then you are assigned to that rotation and you complete it during this semester. Same kind of thing right now. We had a meeting today and she already has over 40 rotations for community, and we'll assign you to that. You know, it's definitely challenging to get acute care. These clinical rotations are challenging, so we're trying to do as many creative things as possible to make sure that everybody gets a really high quality rotation. Does that help? Okay. I think you're muted. Mute,
Oh,
Carol.
I am. Okay.
Yeah.
Another
Okay.
question. Are there any SEL opportunities with Michigan athletics?
Yes. Yeah. So in fact, just this morning at 9 o'clock, I met with one of the RDs who is a performance nutrition dietitian. And he's working with 6 of our students right now, 4 second years and 2 first years. And they volunteered their first semester, and then second semester were hired in. So they've been accumulating hours throughout the whole time that they're students here. In the past, we've had our old interns do like 2-week rotations with sports nutrition. We're trying to determine what that new relationship might be. One of our former students is also at Eastern Michigan University, which is a neighboring college in the town, just 10 minutes down the road. And she takes some of our students also. I have students right now that are reaching out to the professional teams in the area. We're working on an agreement with the Detroit Lions. We have somebody who's perhaps might be able to work with somebody at the Denver Broncos. Somebody else that we have some connections with, the Detroit Red Wings, which is a hockey team. We can't guarantee any of these, but we are always trying to form new partnerships.
Okay, thanks, Susan. I have another question. If a student is working part-time in one of these areas, can it be contributed to their hours? Example, WIC clinic, clinical setting, etc.
Strongly possible, yes. So we need you to just, if it's a WIC clinic, it's a no-brainer as long as you're working alongside a registered dietitian. We don't want you to repeat experiences. We want you to gain new experiences. So I have a second-year student who's been working for the Department of Education, Health and Human Services, because she had this job right after undergrad, and she's getting some hours for that. So we definitely will work with you so that your current jobs and experiences can count for some of these SEL hours, but we also want to make sure that you're exposed to all of these different areas so that you have the knowledge to pass your exam. Any other questions, Carol?
Lots of questions.
Want me to go through the rest of the slides and then I can pull them up and answer them?
Yeah. You keep doing the slides. Go ahead.
Okay. All right, sure. So just to give you an idea, when I talk about like this continuum and these different competencies, this is just what it looks like. And, we also kind of call it a scaffolded approach where one builds on another. So in nutrition counseling, you're going to learn about motivational interviewing, and you're going to do that, like I mentioned, in a really safe environment with peers, other students in your cohort who are pursuing the path to become a registered dietitian. Then the next semester, you're going to take medical nutrition therapy, and you're going to do some case studies. And in those case studies, you're going to take that knowledge application and deepen it a little bit. And then in that also semester, you're going to get real live clients who are undergraduate and graduate students with basic nutrition questions and needs that you'll be counseling along with one of us who's an RD preceptor in an online session. So you really get some experience in practicing that MI with somebody where the answers aren't always predictable, or it may pivot in a different direction. And you're going to have to like kind of go into your brain and pull some of the information that you've already learned and regurgitate that out. And, you know, really just kind of go through the process of real patients. So that's kind of how we apply these knows, shows, and does competencies in a variety of different settings. And we'll obviously, as the program progresses and you're here at the university, will help you navigate that.
I have a question.
Sure.
Yeah. So this may be funny, but what is the best way to explain maybe to a fifth grader what exactly is dietetics?
Oh, that's a really good question. We do a lot of outreach out into the community and work with students at all different levels. We had a fun high school program this past year. So at a fifth grade level, Carol and I used to teach at a sixth grade level. So I would say like a dietitian, if you're explaining to a fifth grade, a dietitian is somebody with specialized education that teaches you how to make the best and healthiest choices in the foods that you eat throughout the day to make your body strong and function for all the things that you want it to do. That's just an off-the-cuff answer. I could probably come up with a bunch of other things.
Yeah, that's interesting. I was just thinking all over to say, like, sometimes how do you, in the field of dietetics, how would you teach maybe kids at that level to really understand what dietetics is all about?
Yeah, I mean, obviously dietetics are, dietitians are people who help people with a lot of various different disease states understand their diseases and how foods can impact the outcome. That's kind of a little more complicated. But also sometimes it's helpful to like teach children from experiences that they know in their own family. Like, you know, oh, my grandma, yeah, she has that diabetes and this is what, you know, she needs to do. And then you can explain to them like how foods and helping her, you know, make choices can impact the quality of her life too. So we talk a lot about quality of life.
Okay,
So
thank
I
you.
have, yeah, you're welcome. I have this slide in here just to kind of show you again, like when we say that we have the scaffolded learning approach, it's just like you build your base through coursework and you build your base through safe experiences. And then as you get more confidence, you feel more confident that you can share those skills outside of your comfort zone. So that's what our new program really attempts to do. And we've carefully kind of curated and organized the coursework in a sequential way so that your skills do build upon each other. So you're really ready to go out into the community and acute care and clinical settings once you have the knowledge that you've obtained that. So, the last thing that I think I want to mention here before we take the last few minutes of questions is that we do have this fabulous nutrition counseling center. This started a couple of years ago when faculty and students from the School of Music, Theater, and Dance here at the university reached out because they wanted our students to provide them with cooking classes and various different lectures and workshops on eating. And so what we decided is it would be a really nice opportunity for our students one-on-one to work with students across the university, completely free, who've got a variety of different nutrition questions, and that they could practice their skills. So last year in our winter semester, when we had our first semester of medical nutrition therapy, we saw about 120 University of Michigan students. So each of our dietetic students had at least 2 full counseling and some follow-up appointments with undergrad and graduate students from a variety of different schools and colleges across campus. And basically, these were some of the topics that our students were able to practice with, like meal planning, healthy eating. Students that are working out at some of the athletic facilities and they want to know how they can fuel themselves for more energy, to be more efficient in their workouts. General nutrition plans. We bring up My Plate and we explain My Plate to the students quite a bit. A lot of students are really struggling. They're eating on a budget. So can we give them some tips on how they can shop, get the most bang for their buck, and have like a really nutritious meal too? So we have a lot of fun in these sessions. They're stressful, but they're also exciting. And students always feel like they've accomplished something when they're done. And you have the safety of having one of us who are already RDs and have a lot of counseling experience in there to save you when needed. And we have like a whole conversation that's worked out in case one of the students is struggling and can't find an answer, that will jump in and help. And the nice thing about it is the U of M students, they're all learning too. They might be coming from different allied health backgrounds. It could be nursing students or pharmacy students or medical students. So they know what it's like to go into like clinical settings and learn something completely new and be uncomfortable. So they're great patients or clients to have because they're just so kind and generous and patient, I would say. So we love that we have this new center and it continues to grow. And as a student here, you will start counseling other U of M students in your second semester. If you're somebody who already has a verification statement, because we do have a handful of students that come in that have done an undergraduate program, you might be exempt from some of your coursework and you might have the confidence to start in the counseling center in your first semester, and we allow you to do that. And I think that's all I have. So why don't we take the next couple of minutes to answer any additional questions that you have. And I can also pull up the chat if that's helpful, Carol. I don't know.
Yeah, I mean, I've been answering them, but one of them that just came in was about if you have a DPD statement. If you want to just, I mean, you elaborated on
Yeah.
that.
So I think in our first year cohort, we had about 8 to 10. In our second year cohort, about 8 students that came in and they did undergraduate dietetics. So from their DPD director, they have a verification statement already. And so what does that allow you to do? It allows you to get exempt out of coursework so that you don't have to repeat it. And we have forms that you'll fill out once you become a student here. It allows you to jump into some opportunities a little bit sooner. It doesn't allow you to eliminate any of your supervised experiential learning, because if you're coming in with that, you haven't done an internship. So you need to get all of your supervised experiential learning hours in. And if we find that you took a course that you either didn't do as well as we would have liked on, or the content was a little inferior, we may ask you to take it again. But you can also just sit in on it and you can audit it too, or we could give you access to the course site so that you have the material. So we really like working with students who have DPD verification statements, but it is not a requirement to come into the program, but you are welcome. And we have some pretty good experience knowing what works best too. And then, so how do you there was a question about the DPD verification statement. I don't know if that was actually the question. If you went to an undergraduate dietetics program, you know what it is. If you didn't, then you don't have any worries. You don't have to get one of those. And another thing to note is even if you did go to an undergraduate dietetics program and you have a verification statement, I'm still going to give you one for your graduate program so that you can sit for the exam, because that will only get you into a dietetic internship, the DPD verification statement. But when you complete our program and all the supervised experiential learning hours, you get the statement from me that says that you can sit for the exam. So everybody who's in dietetics will get that when they're done, after August of their second year.
Hey, it's 5:30, Susan.
Oh, I have a question, maybe a different one.
Yeah,
yes. Go right ahead.
Yeah, you said something about the Kira interview in the chat section, and there you said that the career interview is for students who are pursuing the dietetic path. So my question is, this career interview, do you take it before being admitted or after you're already admitted and now you have decided that you're going to go for the dietetics? Or where do you make that decision that, for example, I'm in the MPH program, where do I make the decision that I'll go for dietetics? Is it when I'm already in the program or before I'm even enrolled in the program?
Yeah, so can you still hear me? Because my computer's doing something wonky now.
Yes, I can.
Okay, I'm gonna stop sharing because it wants me to update. Okay.
Susan, do you want me to answer that?
Yeah, go ahead. I mean, I
Yeah.
actually, as long as you guys can see me, I'm fine. We really need you like by the first drop ad deadline of the semester to determine whether or not you do or don't want to be in dietetics, and preferably at the application process.
Yeah.
Because if you want to be in dietetics, once again, you have to do your Kira interview. So
Yes.
the requirement, and we are only accredited for a certain number of students in every cohort. And so we need to make sure that we also have room for you.
Yeah. So
Yes.
just to kind of follow up with what Susan's saying. So if a student is MPH dietetics, they cannot submit their application until they have completed their Kira interview. So we cannot even see your application until that interview is complete. Whereas if you're more interested in MPH nutritional sciences and not dietetics, then you do not complete the Kira interview. So hopefully that there's some distinction between those two.
I also want to say for the Kira interview, like this is not anything to stress about, and you can't prepare for it. So we're not going to be asking you clinical questions, in-depth dietetics questions, testing your knowledge on micro and macronutrients. We're just going to ask you random questions, that you should be able to think on the spot and answer with that 30-second preparation time. It might be the same kind of questions that you might get if you're, going out to dinner with a friend who just moved to the town where you live, something like that. So please don't procrastinate doing this very, very short interview because it's going to delay the submission of your application. I think that you'll hopefully find it relatively stress-free. And again, it's just one part of this very holistic application process that we have. Any other questions? Feel free to send me an email I'm happy to hop on a separate Zoom if you've got some really unique things that you're thinking about in the future, or just answer questions via email. Happy to do that at any time.
Hello.
Is there another question?
Yeah, hello.
Hi.
Yeah, please, can we get your email address in the chat box or?
Oh, yeah, Carol just put it in. Looks like that. Maybe that's it, Carol. Is the acceptance?
Hello.
Yes.
Yeah, okay. I wanted to also ask that I'm Esther from Ghana, okay, and I have public health nutrition as my undergrad. So can I apply for dietetics as my master's program? And what are the requirements? Do I also need a clear interview? And I just want to know, have an overview of how I can apply and the things that are required for the application. Thank you.
Is that did you say for the MS application?
Yes, please.
Yes. So were you here for the first part of the presentation when we talked about applying through Rackham?
No, please. I just joined when they were on the questions and answers. So I
Okay.
joined.
You know what I would suggest then, why don't you send me a separate email and I can go over that via email. The other thing that might be really helpful is when you get the recording from the first hour, we went into that in pretty good detail, but we'd also be happy to answer it one-on-one via email with you.
Okay, please. Then please, I would like to see the email address in the comment section.
So it is actually, my email is there. Carol Durgee at 5:34 p.m. Put it in the chat. I'm Susan Aronson. And there's a question there about the acceptance rate. Yes, similar. But again, we do have, each cohort is accredited for 40 spots, and we have filled the last 2 years. So I would just encourage you to get your application in as soon as possible.
Okay, so I think, thanks for coming, everybody. And there was a question about the recording. You will receive a copy of the recording and also of the slides, so you can go back and review all of that information. And as Susan said, you can reach out to Susan, myself, or Keegan with any questions. We're here to help you through this process and, making some big decisions. So let us know how we can help. And we're really happy that so many of you were here this evening. Thank you. Okay, and Lindsay had a one last question. So our admissions is not, well, I'll give you some dates. So December 1st is kind of our priority deadline. It doesn't mean that you have to have your application in by that time, but we encourage you for the MPH and MS to get it in by December 1st. With that being said, you can actually submit your application until May 15th. International students must submit their application by January 15th. We encourage you to submit your application early because everyone is considered for a scholarship based on merit and need. And if you submit your application in late March, we don't know how much scholarship money we will have left. So the admissions committee will start reviewing the MS and the MPH applications in January and February. And so it just means that if you get your application in, Rackham and Sophus, they have to make sure that everything is complete before we can see it. So we encourage you to get it in earlier than later. So hopefully that helps. But don't stress if you don't have to have it in by December 1st. So anything else? Okay. All right. Well, thanks again, everybody.
Hello.
Thank you.
Yeah, please. It's like I missed the email address. I wanted to say, but I can't find it in the chat box again.
My email address, I can put it in again.
Yes.
I'm going to put it right now.
You.
Actually, Carol, I can't. My computer's doing something wonky again. Can you add it again?
Yep.
My computer.
Okay. I just did mine. And then I'll do Susan's, and Keegan's she's done hers as well. All right. Okay. Well, everybody enjoy wherever you are, your evening or morning, and we'll connect again soon. So thank you.
Bye, everyone.